Good morning, everyone. Thank you so much for joining us this morning. Today, the City of St. Louis officially announces the launch of our new Behavioral Health Bureau. Joining me this morning to offer some remarks will be the Honorable Mayor Tashara Jones. This is who made this happen, so let's have another round of applause, please. We also have joining us this morning Serena Mohammed, Chairperson, Board of Health and Hospitals for the City of St. Louis. Dr. Laura Knott, Deputy Director, Missouri Department of Health and Senior Services. Dr. Daniel Isom, Interim Director, City of St. Louis, Department of Public Safety. Felicia Spratt, Director, 911 Diversion Program, Behavioral Health Response. And announcing for the very first time publicly, our new Commissioner of Health, Victoria Anwary. Joining us virtually, Dr. Scott Timms, Project Director, CDC Foundation assignee to the City of St. Louis Department of Health. So just to get some business out of the way, all of the speakers will make their remarks and we'll open up for questions at the end. I also ponied up some money for some food for everybody, so we'll have refreshments at the end too. Everyone should have or can ask one of the members of my amazing team. We have a booklet with information for everyone today as well. The Department of Health has invited you here today for the official launch of our new Behavioral Health Bureau. Today, in the City of St. Louis, we begin transitioning from talking about mental health and substance abuse concerns to making a major, equitable, data-driven approach to addressing those concerns. For me, today is actually a really special day. Next Tuesday, October 18th, marks my first year with the City of St. Louis. And today, I'm delivering on a priority that I set when I first sat down with the Honorable Mayor Tashara Jones to discuss this position. She may not remember that interview day, child, but I won't forget it. I was sitting at home, I just fed my baby, and I was about to meet with the mayor for the very first time. A woman that I had long admired, the only woman and only leader that would have seen me leave clinical care to come and take this post. At that meeting, it was important for me to discuss with her priorities and compare them to mine. And it was really hearing and realizing that our priorities were aligned that made me happily accept this position. So it truly is a really special day for me that a year after we were plotting together about how to best serve the city as it pertains to public health, that we are delivering on that promise. According to the World Health Organization, mental health conditions and substance abuse disorders have increased globally by 13% in the last decade. In the United States, approximately 1 in 5, and that's 21% of adults are living with mental illness. That's 52.9 million, and that number is from 2020. Knowing what we know about COVID-19 and the pandemic, we know that both the quantity and the severity of that issue has increased substantially. The City of St. Louis has the highest rate of mental health-related emergency room visits in all age categories compared to St. Louis County and the state of Missouri. There are also more mental illness treatment services in the City of St. Louis compared to St. Louis County and the state of Missouri. Our new bureau will focus on mental health and substance abuse, but our initial efforts will predominantly concentrate on substance abuse, particularly the opioid crisis. Leadership is important to me. And if my leadership style has not been clear to you thus far, let me be abundantly clear this morning. I am only as strong as my team. So I interviewed over 50 candidates across the country for the core leadership team to drive the strategic plan and implementation strategy for this Bureau to ensure that those selected shared the vision and goals for this Bureau to align with the community and its need for equity. This Bureau will prioritize the long neglected behavioral health support, especially for Black and Brown communities in the city of St. Louis. I now have the distinct honor to pass the microphone to the Honorable Mayor, Tashara Jones.
Thank you, Dr. Slachwayo Davis, for your vision and your commitment to this important issue. Good morning, and thank you for joining us today to celebrate the launch of the City of St. Louis Department of Health's new Behavioral Health Bureau. This new Bureau's focus will be on two pillars of behavioral health: access to mental health care and addressing substance abuse and abuse. The need for this work is critical. Our city has the highest prevalence rate of mental health-related emergency room visits in all age categories compared to St. Louis County and other counties across Missouri. Meanwhile, drug overdoses are the #1 leading cause of death in Missouri among those ages 18 to 44. And St. Louis City faces the highest rate per capita in the state. According to the data from the Medical Examiner's Office, drug overdose fatalities increased in the city by 30%, from 317 in 2017 to 448 in 2021. At every town hall I've been to this year, community members emphasize the need for better awareness of and access to mental health care. Residents across our city see firsthand in their neighborhoods the human cost of failing to invest in behavioral health care. That's why in this year's budget, the first passed by the Board of Aldermen and onto the mayor's desk since 2019, we increased funding to the Department of Health to staff this bureau. It's a commitment by myself and St. Louis to treat mental health as a critical component of well-being. Promoting behavioral health awareness, effective preventive measures, early detection, and treatment improves physical and community health. It makes our neighborhoods healthier and safer. Addiction, lack of access to mental health care, these are some of the root causes of crime that we can work on to address before they result in a crisis, an emergency room visit, or worse. So when we say that crime is a public health crisis, it's work like this that will make our city safer in the long run. With this commitment to mental health and treating substance abuse, St. Louis is taking a major step towards improving the quality of life in our city, expanding access to health care, and improving public safety. This bureau will be key in coordinating work with partners, our schools, and everyone else in the community. And to be clear, these issues are not unique to our city. And as St. Louis works to address mental health and substance abuse issues, especially around the opioid crisis, we will look to work with our neighbors throughout the region as well. Regional problems demand regional responses, and this new bureau will help us find solutions across city and county borders and across rivers. I want to thank Dr. Mati Slachwayo Davis for her visionary leadership and her commitment to a holistic approach to public health and public safety. Thank you as well to our public health and safety partners who are committed to this work and protecting our residents and getting them the support that they need. Thank you again, and God bless.
Thank you, Mayor Jones. It's easier to do your job when you have covering. It's easier to do your job when you have someone who not only listens but acts on your behalf. I genuinely thank you. We will now hear from Serena Mohammed, Chairperson of the Joint Board of Health and Hospitals for the City of St. Louis.
I would like to add a warm welcome to all in attendance today from the Board of Health and Hospitals and extend our congratulations to Dr. Mati and her dynamic team for swiftly moving from idea to action. The role of Board of Health and Hospitals is to bring representatives of the healthcare and public health community together to advise and support the City's Department of Health. This is an opportunity that is of great importance to give voice to community concerns and find solutions together. Without naming all of our members, I will say that we have had long-standing advocates for mental health. It has always been a hope of the board that our city could lead effective behavioral health strategies that would serve residents in a comprehensive way. So we are very pleased today to witness such an important step in that direction. We appreciate the leadership and partnerships that have gotten us this far and look forward to strengthening and building new partnerships along the way. Behavioral health is a fundamental part of health. Today's action recognizes the importance of addressing the well-being of the whole person. We want our residents to have the resources and supports they need to lead full lives, to thrive, and be well. So it makes sense that our Department of Health is centering its public health strategy on making that a reality. This is a chance for all of us to come together in partnership to serve. We are enthusiastic about what this Bureau will accomplish, and we are optimistic that we will experience real change in the health and well-being of our region. Thank you, Dr. Mahdi, for taking this from vision to reality. Look forward to working with you throughout the years.
Thank you. Chairperson Mohammed, you have been a leader not only for the board, but specifically in your capacity with the Mental Health Board and for this city for equitable practices forever. I've also been very fortunate to call you friend way before we started doing business together. So this is a really great day for both of us. Thank you for your vision, for your leadership, and more importantly, for your accountability. Thank you. We'll now hear from Dr. Laura Knott, Deputy Director, Missouri Department of Health and Senior Services, who came a long way to be here, so thank you for your commitment.
No, thanks for having us. Good morning. Thank you to the City of St. Louis Department of Health for inviting me here on this significant day. As mentioned, I'm with Missouri Department of Health and Senior Services, and we're very excited to be supportive of this endeavor. This day is exciting for us this day is exciting for us and our partners in both public and behavioral health, and will be life-changing for many of our Missourians living here in St. Louis. Behavioral illnesses and substance use disorders often go hand in hand, sharing risk factors, some genetic vulnerabilities, and environmental influences in Missouri. In Missouri, drug overdoses, both fatal and non-fatal, have become an epidemic over the past decade. As mentioned, among Missourians aged 18 to 44, drug overdoses are the leading cause of death, with the St. Louis area experiencing far more of these tragedies than any other area of the state. In very recent years, we have seen some major shifts in the primary drug involved in overdose deaths, with heroin being replaced by synthetic opioids such as fentanyl. We also continue to see the residual effects of the COVID-19 pandemic that has placed on public health. From 2010 to 2019, a span of only 9 years, the number of drug overdose deaths increased in Missouri by almost 600. From 2019 to 2021, in just 2 years, that number of drug overdoses again increased by almost 600. At the state level, we stand ready to assist our partners in serving the residents of St. Louis to turn these numbers around. We have partnered with several Missouri local public health agencies to implement federally funded overdose data to action program initiatives. We are currently establishing new contracts with them, many of which are located here in the St. Louis metro area. Through a partnership with the Missouri Institute of Mental Health, we are also continuing to support a centralized naloxone distribution, tracking, and reporting system. DHSS is also collaborating with the Missouri Department of Mental Health to provide funding to support preventative resource centers for substance misuse prevention efforts, including the St. Louis-based Prevention Resource Center, PreventEd. Overdose data to action funds were used to implement overdose prevention initiatives focused on, among other things, local community coalition support, and overdose prevention curriculum in schools. Additionally, we have provided overdose data to action funding for transportation services in St. Louis to St. Louis area residents to access substance use disorder treatment services. It is inspiring to see the City of St. Louis Department of Health bring a new level of focus and resources on substance use and mental health disorders, a need that is so great across this nation, but especially right here in St. Louis. The benefits of working to address behavioral health issues by advancing treatment efforts, increasing educational opportunities, and reducing the stigma associated with mental illness will reach far beyond the mental health of St. Louis residents. We are looking forward to our continued partnership and together promoting health equity and access to overall community health and well-being. Thank you, Dr. Davis.
Thank you, Dr. Knott. We have the best partners, I swear. I'd like to publicly thank you and acknowledging you for providing the operational budget for the first initiative through the Department of, through DHSS. And we have been able to secure through the Overdose to Data Action program that Dr. Knott spoke about, $400,000 for our first year for this new bureau. Thank you. I'd like now to bring up our interim director, Dr. Daniel Isom, City of St. Louis, Department of Public Safety.
First, I'd like to say congratulations to Dr. Mahdi on the launch of the Behavioral Health Bureau. It's certainly much needed in the City of St. Louis. The Department of Public Safety is committed to the safety of residents and visitors to the City of St. Louis. Since the inception of Mayor Jones's administration, we have talked about a holistic approach to addressing crime and safety in the City of St. Louis. We recognize that mental health is a big part of the safety individually of individuals, but also collectively of our community. We know that community dynamics, family disruption, other factors cause considerable strain in individuals and families. And that's manifested in many ways, and oftentimes the coping mechanisms for those strains are not productive. So mental health is a needed service in our community that will help us to reduce violent crime in our city. And we look forward to partnering with the new Behavioral Health Bureau as we continue to make St. Louis a safer city. So congratulations to you and to Mayor Jones.
Thank you, Dr. Isom. Long before this bureau was even conceived of, it was Dr. Isom's leadership that allowed us to do innovative partnerships that you'll hear about next around behavioral health, around addressing the opioid crisis, the mayor's innovation and leadership around standing up a new Office of Violence Prevention earlier this year means that the Department of Health will continue to be intimately in partnership with the Department of Public Safety. Thank you for your vision and your leadership, Dr. Isom. Next, we now have Felicia Spratt, Director of the 911 Diversion Program at the Behavioral Health Response. Thank you for being here with us today.
On behalf of Behavioral Health Response, our Pat Coleman is our CEO. We say congratulations on the launching of the new Behavioral Health Bureau. Along with me, I have Lieutenant A, who is a partner on the crisis response unit. Behavioral health response ensures compassionate and immediate, barrier-free access to behavioral health care. At BHR, we pride ourselves on respect, integrity, excellence, and accessibility. In priding ourselves on these core values, BHR is excited in joining the City of St. Louis Department of Health and launching of their new Behavioral Health Bureau. BHR is regionally and nationally known for our crisis line, which also includes the newest 988 phone line for those who are experiencing mental health concerns. In February 2021, BHR's Justice and Crisis Response Unit, J-Crew, created a first of its kind street triage co-responder model where a trained crew, clinician, and officer partners with St. Louis Metropolitan Police Department and travel on calls related to behavioral health such as mental health, substance use, trauma, quality of life events, self-sufficient needs, and so much more. The Crisis Response Unit provides a first, second, and post-event response system. This model ensures crew teams are the first to respond whenever possible, are called to the scene quickly when they are not the first to respond, and continue to follow up on the cases after their initial response. When crew responds and appropriate response to our residents, we also have our 911 call diversion, where clinicians work alongside with the 911 communication dispatchers to meet callers' mental health needs and prevent unnecessary dispatching of emergency personnel. BHR will continue in unison with the Department of Health to build a stronger community as we all continue to save lives.
Thank you so much, and for your partnership. Again, before this Bureau was conceived of, Mayor Jones and her administration were committed to this issue, providing the Department of Health through ARPA funding opportunities to support much needed measures through critical partnerships. We consider you the flagship, the flagship partnership for that in the city, and this program and the data behind it just is incredible what we have been able to do just in 1 year. We in the second year, we're so excited to be able to expand that to 24-hour service 7 days a week, and it will save so many more lives. Thank you so much for your partnership. Last but not least, our final speaker will be Dr. Scott Timms, Project Director, CDC Foundation assignee to the City of St. Louis Department of Health. Dr. Timms will share some information about how the new Bureau has been structured and how it will operate. Dr. Timms?
Thank you so much, Dr. Mowdy, and everyone on this panel. I don't know that Zoom sometimes communicates the excitement that I might have after hearing this conversation, and how lucky I feel as a public health professional to be in a city that has so fully embraced health and well-being and what this could do for your citizens. So again, my name is Dr. Scott Timms. I am excited to be part of this new Bureau and to be leading the OD2A team. My goal for really being here is about how we improve the health and well-being of this community. And with such great support, I feel like we will have great success. For me, when I talk about behavioral health, it is a state of well-being in which every individual realizes their own potential, can cope with normal stresses of life, can work productively and fruitfully, and can contribute to their community. I feel like we've been positioned at a really important time in the history of St. Louis to do this work and to do it well and equitably. As Project Director for Overdose Data to Action, I'm excited to partner with everyone on this panel and many of you that are listening. And our work is really not to come in and supplant anything, but it's to engage and support the current efforts and to help enhance the work that's being done, and how can we build new partnerships and look at this in different ways. We bring clean eyes to this work, which is really exciting. We want to enhance everything that's being done currently through a data-driven, equitable, and community-focused strategic planning and implementation process. And I have a wonderful team of people here to help me do that work. So let me introduce them really quickly. And I apologize now for any names that I may flub, because I have too much excitement in my mouth today to say this well. But Benita Gibb is our strategic planning coordinator. Vincent Adeyemi is our program and implementation coordinator. And you guys can wave when I say your names. Ani Vartanian is our data analyst. Nadi Krishna is our epidemiologist. Rhea Contractor is our assessment coordinator. And then Dr. Sherilyn Duckworth, who will focus on health equity, diversity, equity, inclusion, and accessibility. A really long word to say. She's going to be looking at everything and how we do this work in ways that reach everyone that needs access to these services. So it's very exciting to me. I'm excited to be here. I'm excited to work with this community, and I look forward to what's next. So I will say, and I always try to have an ask here because I don't get opportunities to speak to everyone often, but we will send out an email later this week to community partners and for folks that we've identified that want to be involved, asking you to attend a webinar so you can learn more about the Bureau and OD2A and that we'll do 2 of those sessions towards the end of the month. So keep an eye out for that. We're also going to send out a needs assessment because we need to learn about all of the wonderful things that are happening in the community and how we can begin to bring partners together. We've been doing some of that work already. So So please watch for communications from me. If you don't get them, reach out. I would love to connect and talk with you and connect you to my wonderful team. So, and again, thank you to Dr. Mati and the wonderful people in St. Louis for giving us this opportunity to do this great work. Thank you.
Thank you so much, Dr. Timms. Many of you will remember earlier in the year, I welcomed the CDC director, Dr. Rochelle Walensky, to St. Louis. She asked for an hour with me. I counter-asked for 6 hours. She spent 6 hours with this department. She met my amazing team. And one of those times, and this was historic, by the way, this was the first health department that she had chosen to visit in her entire tenure as the director for the CDC, was our health department here in the city. And as one of those asks, I wanted to really make it clear to her the level of disinvestment in public health, and specifically in behavioral health. She has delivered on one of 3 asks I made of her. This was one of them, to provide us with support for a foundational team of national and global experts to really get this off the ground, to help us bring together the 14 salaried positions that our mayor has supported us with. That couldn't be more exciting. These are people who care about what I care about: equity, providing support for the most disenfranchised amongst us, a data-driven approach to this. So very exciting. Thank you so much, Dr. Timms. Thank you so much to the team. All right, we're wrapping up, folks. You're doing great. Thank you again for joining us today to launch our new Behavioral Health Bureau. We look forward to implementing this equitable, data-driven approach to assessing needs and delivering services related to mental health and substance abuse in the cities of St. Louis.